Hi, I'm Vicki Ruffing here with Dr. Bingham to answer questions about the seasonal and H1N1 flu. Dr. Bingham, we've been overwhelmed with questions from patients with RA and other autoimmune diseases about what to do this year with these flu shots. I think we have got to address this.
Vicki, that's a great thing because everybody sees all of the news, everything that's been going on, talking about flu shots, talking about swine flu shots, talking about H1N1, and I think it's a very topical thing for us to begin talking about.
Absolutely. So I think our first question that we'll address is, in the news, there's been these recommendations that people who are immunocompromised receive the flu shot. The question from the patient is, am I immunocompromised because I have RA? Do I fall into these categories?
Vicki, that's a great question. The answer is yes. Patients with rheumatoid arthritis and patients with most forms of autoimmune diseases actually have a compromised immune system even before we put on any additional medications. So you're sitting out here, your immune system's not working completely correctly, something comes along and you may not be able to fight it. So absolutely, we want to get people immunized. We want to give you the best possible chance of not having a problem if you're exposed to one of these viruses. Now, we can talk about people as well having an increased risk even further because of the medicines that we use. We use prednisone, we use medicines like methotrexate, we use injectable medications, we use infusible medications, and all of these further increase the risk of infection. So absolutely, people with RA, even if they're not taking anything except prednisone, absolutely need to be immunized.
That's good to know. Now, we have two different vaccines this year. We have an H1N1 vaccine. We have a seasonal flu vaccine. Are we going to recommend that patients receive both vaccines?
Well, that's also a great question. Absolutely, we really recommend that everyone do receive both the regular seasonal influenza vaccine, that's the one that's been around, that we get every single year. But this year, as you know, there is a new form of flu. It's called H1N1. It was originally referred to as swine flu. And this is a completely new flu virus that hasn't been around. So we do need to get a second immunization for the H1N1 new flu for this year, in addition to the regular seasonal flu vaccine.
One of the questions I recently received was about if it made a difference whether one of our patients received an injection or the nasal spray. I tried my best to explain that we really would not recommend that people receive the nasal spray or what's called flu mist, because it does contain a small amount of the real virus. So you're given the real virus to build up a resistance rather than a killed virus. So our recommendation would be then to only receive the shot, not to receive the flu mist. That flu mist is available in both the H1N1 and the seasonal flu, so be careful that you steer away from it in both cases.
Absolutely. I think that's a great point really to emphasize. Again, patients with compromised immune systems should not receive the intranasal spray vaccine versions. We absolutely need people to receive the injections, even though this is 2 shots and it might be a little bit more inconvenient or uncomfortable. There is a danger for people receiving the nasal spray, so we really would not recommend that.
Well, actually, as a matter of convenience, if you do receive the 2 shots, you can do that on the same day. You don't have to wait between injections, so it may not be an inconvenience.
That's a good point, because the nasal sprays, you do have to wait between the 2 in order to get maximum immunity.
Okay, so let's take a look at our next question. Are the vaccines safe?
Well, this is a great question too. Everybody's worried about immunizations. Everybody's worried about, is there something different about this vaccination, especially for the new H1N1 in contrast to the other flu vaccines? And the answer is, there is no difference between the ways that these are manufactured. There's no difference in the way that these flu shots have been being made for the last many years. and the risk that people experience from these tends to be maybe a little bit of soreness in the arm, even if you have somebody who's good in terms of giving the shot. Some people do feel a little bit achy the day after, or, for even a few days after they receive it. But these injections do not contain any influenza virus. They don't have, that's a lie. They have nothing that should make you sick. And people are also concerned about all of the things that might go into these. The only real contraindication are people who have an allergy to eggs.
Right, right. So I think we have an idea of what the patients need, but now here's the question. I have RA, I'm going to get the flu vaccines. What does my family do? I have children and a husband. How do we handle this?
So this is a very good question as well. Most pediatricians are giving the flu mist to children, and it turns out that when you give the nasal spray, people do shed virus. It turns out, though, that in terms of pediatric dosing of the nasal spray, there doesn't appear to be any significant increased risk to adults for the virus that's there. That's not the case for adults, however. In adults, if you receive the intranasal flu mist type vaccines, you will shed live virus. And if someone has a compromised immune system, you could be exposed to that and potentially get sick from the immunization itself. So we generally would recommend that people, again, if possible, the immunizations be given to family members. But in the case of a child, the dose is small, and if they do get the intranasal spray, which they may get at school or other places, that should not pose any significant risk to an adult. But just don't let it be your spouse or your grown teenage kids that are getting the nasal spray.
Okay, so the flu mist is okay for my kids, not okay for my husband. He needs the shot.
Absolutely.
Got you. Dr. Bingham, we received a question. My child is 7 years old with rheumatoid arthritis. How do I handle a flu vaccine in this case?
That becomes a really difficult question to answer. It would depend to some extent on what medications that child might be on. It may depend on the degree of immunocompromise that they have. I think the child with rheumatic diseases who is on immunosuppressive medications, the rules regarding flu mist may not apply. I think that the best thing for someone to do would be to speak with their pediatrician and preferably with a pediatric rheumatologist concerning that situation, because I do think that we don't have great guidance at this point in that specific situation.
Okay. So, Dr. Bingham, I think we covered quite a few questions here. I think to sum it up, we do recommend that patients that are immunocompromised or immunosuppressed receive both vaccines. They should receive them in the injection form. Family should receive the injection if possible. If it's children, it would be okay in pediatric doses to receive the flu mist. And I think that it's fairly clear that these are safe and very important. We really would like to see all of our patients' immune systems built up so that they can resist this flu if they're exposed. We know these recommendations are changing daily, hourly, every evening when we watch the news. So I would just like to say that if anybody needs additional information or wants to make sure they're most up-to-date information, please visit the CDC website. That will be underneath of our video. You will be able to see that website address. It is www.cdc.gov. Thank you very much.